If you're hypermobile and your lower back and pelvis always seems to be off, this video is for you, because that's going to change how you work out and what your focus should be. Let's talk about traditional workouts. Traditional workouts, in my opinion, provide a lot more damage than good, because majority of people don't even understand what proper mechanics are. So their goal is to increase the number of sets and reps, and the body will give it to them, but at a cost of dysfunctional patterns of movement. When you're hypermobile, traditional workouts definitely fall apart because of the fact that you don't have joint stability. So one of the things that happens with connective tissue disorders is most people think you're flexible, when in reality, flexibility is a great sign of healthy joints. What's happening is instability to the point of extreme movements, and it's mistaken with flexibility. So traditional workouts end up hurting you because the stability is not there, and when you do something wrong and you don't have the stability in the joint, it changes and it turns into quite a bit of injuries. And because of the connective tissue disorder, the recovery rate is slower, so it becomes a disaster. In fact, when you go to offices where their traditional, let's say, physical therapy rehab is being done, those can be very painful and hurtful and injurious as well, because of the fact that they don't apply to unstable joints. So the question you may have is, well, what do I do now? That's a very good question, and thankfully I do have the answer. If you look at the world around you, where all of us are born barely being able to hold our heads up, we can't do anything, and we go through stages of movement where finally we start walking, and next thing you know, we're running. No one tells us what to do. There are no gyms, no bands, no weights. We use our body for movement. And so it is fair to say this method materializes into stability and movement, and it is something that we're hardwired to do. So if we use the same methodology and the same exercises to bring stability and understanding of what principles of movements are, then we've got it made. In fact, I treat joint hypermobility, and majority of my patients are in fact hypermobiles. And I can tell you that I see beautiful results of working on establishing the right patterns of movement using developmental exercises. The best part of it all is that throughout the process, I make sure that the patient understands what we're looking at, because when you understand something, you own the knowledge. When you memorize it, you'll forget. So if your mind already, I always say, you know, we're like two people. One is your innate mind, your instinct, and the other one is your conscious mind. So when your conscious mind sees what proper movement that you were born with, that you already knew about, can look like and can do, then you can materialize the movement into something that establishes stability. So developmental exercises are what I use, and the first step in the right direction is always breathing. Breathing for everyone, and more so for individuals who have the lack of certain things, becomes the best tool ever. So for instance, anxiety is one of, and being panicky is one of the common characteristics found with hypermobiles. When you're breathing, what I refer to as biological breathing, if you don't know how that's done, please make sure you subscribe to my channel and turn that notification bell on. We'll put that breathing video at the end of this video, so make sure you watch it to see how breathing is done. This breathing, which I call biological breathing, is what we understand by studying human babies. So when you breathe biologically, you actually manage your heart rate tachycardia. You manage stimulating and regulating your vagus nerve, fight or flight. Your digestion, so important. So everything that, not everything, but a lot of different things that you may be experiencing, the breathing, the proper biological breathing will address. So developmental exercises always start with biological breathing, and then there's a lot more that goes into that. If you have subscribed to my channel, you get to see the example of some of these exercises, but you gotta understand these, it's not what they look like, it's what they feel like. Understanding what each movement is to bring for you and what to look for that make a difference. If you need help with your, not just back and SI joint, not with your TMJ, but with your joint hypermobility, your movement. If you have issues with that and you need help, please make sure you contact me using one of the methods of contact in the description box. I've made sure to include a link where you can actually schedule a call, and we will contact you and see what's going on and if this is something I can help you with. But do understand that hypermobility is highly manageable if you know what you're doing. So do understand that there is a solution, and all you have to do is seek it and go after it and not to give up. Hypermobility is not something you can make go away, but you can definitely manage it very well. Thank you so much for watching, and until next time, take care.